Hey guys, thanks for clicking on this video. If we've not met before, my name is Danny. I'm on my journey to becoming a doctor, but I also work as a healthcare assistant in my local hospital. This video is going to show you guys how you can smash that pesky healthcare assistant interview. Don't worry too much, it's not a super difficult interview, but I'm going to give you the little heads up on things that you might want to know before you get to the interview. So watch the rest of this video for the best tips. So having been through the interview, had a look online and spoke to my colleagues, there's similar questions that tend to come up in the NHS Healthcare Assistant interview questions, but also the care assistant interview questions elsewhere, you know, in nursing homes and that kind of thing. Now, ultimately they just want to see that you've got a bit of personality, that you can be trusted to do the job, and that, you know, you actually care about wanting to come and work in the NHS. So I thought the best use of your time would be to go through some questions, and I'll talk a little bit about what they're looking for in those questions. Question number 1 is, why do you want to be a healthcare assistant? So this question can be broken down into two main parts. The first part is the why. So obviously you have an interest in helping other people and you have that caring persona. You know, when you see someone struggling, you want to help them. And you want that in your everyday job, which is ideal as a healthcare assistant because you're right on the front line with the patients. Or you may want to come and work in a big team environment and learn lots of information from other healthcare professionals like nurses and doctors and physios. Any chance you can mention the word multidisciplinary team, you're going to get brownie points because they love that term. As a healthcare assistant, you'll work alongside physiotherapists, occupational therapists, speech and language therapists, nurses, doctors, just to name a few. But there's lots of different professions and they all come together in a multidisciplinary team, and it's important that you identify that is what will be required as part of the role to be part of that team. Then you'll want to tell them a little bit about what you can bring to the role. So are you a hard worker? Are you someone that's always looking to improve when you're at work? You know, try and do that job as best as you can. Especially in this role, you're a professional, so it's important that you take care in what you're doing and pride. If you can say anything about being safe, you know, and making sure you don't go beyond your limits, that is also something that they really like to hear as well. So question number 2 is the 6 C's: care, compassion, competency, courage, communication, and commitment. So I myself didn't know all of these before coming into the interview, and I had to come up with them on the spot. So you guys are already a little bit ahead of where I was coming into the interview, and I did get a job. So you guys are in a good position when you go into that interview. Now, all of the 6 are super important because this is embedded into nurses' everyday work. It's important that you make sure you acknowledge that all are super important, even if they do ask you to choose one that you find the most important. If I was to choose one that was the most important, I feel like competency would be a good one to go for. Working in healthcare, it's super important you know what you can and what you can't do. Therefore, understanding your competency in your role is vital to keeping patients safe. Especially with healthcare assistants, because there's a big range on what you can and can't do in different departments. So for example, if you've been trained to do cannulas and bloods, then you can do so if you're asked to. But you may be asked to do bloods by a doctor who doesn't know what your training level is. And it's your responsibility to say, sorry, I don't have the training to do that, but I will go and find somebody that does. Number 3, how would you deal with an aggressive patient? So obviously they don't want you to come in knowing everything, but it's important that you take the right approach. So making sure that it is safe to approach that patient before you just go rushing in there, because you don't want to cause harm to yourself or to other patients. Therefore, take a little bit of a risk assessment before you approach the patient. Decide to approach the patient. It's important that when you're communicating, you have an open body language and you change your tone of voice so that you don't escalate the situation further. Sometimes it may not be appropriate to approach the patient and you may need to call for help. That may be another colleague, or you may want to call for security if there's a threat to either other colleagues or to other patients. Unfortunately, it is a reality working in healthcare that you'll come across people and patients that become aggressive, and it's important that, especially once you're trained up, that you have the right approach. An example of where a patient could be aggressive is if they have maybe some sort of dementia. Question number 4 is, what is confidentiality? This is a super important question because actually we deal with sensitive patient information every day from the moment we get to work. Therefore, we have to know how to handle it. We need to make sure that we appreciate that patients have confided in us to deal with their information, and we respect that by making sure that we respect their right to privacy. This is important because if patients can't trust us with their personal information, then they will be less likely to come forward and offer sensitive information that may be vital in order to get the best treatment that we can get for that patient. An example may be they might not want to talk about their sexual health problems, and that can be super important in some cases. A good example is when a patient's family will call on the phone to the wards and they will ask for information, let's say a test result for their family member. Now, if you just give this information out, that may be a breach of their confidentiality because the patient might not want their family to know about that medical condition or the test result. And therefore it's important that you check the patient's notes, that the patient has given permission for you to talk to that member of the family about their medical information. Often we have to say to people that we can't give them that information, and if they want to know more, they'll have to speak to that individual or that member of family that's been given permission to talk to the nurses and doctors. Question number 5. What would you do if somebody asked you to operate against your manual handling training? Now, this is straightforward. You would just say no. Now, as a healthcare assistant in some wards, you may be required to do quite a bit of manual handling. For example, rolling patients, helping move patients from one bed to another, and you get training on how to do that safely. If you operate against this, you are taking an unneeded risk that you could hurt the patient and you could also hurt yourself. So it's super important that you never operate against the manual handling protocols, and that you say to that person that you're not going to do that because you have a responsibility to the patient and also for your own health. And another good response is that the protocols are there for a reason. Often protocols are made because when problems happen, they put protocols in place to stop problems coming up again. An extra tip is to refresh your mind on what safeguarding is. So everybody that works in the NHS has to go through safeguarding courses. Safeguarding is to protect patients and colleagues from neglect, harm, and abuse. If you ever notice something that doesn't feel quite right, there are certain procedures and protocols, people that you can raise an issue to. Safeguarding is super important and sometimes can come up in the interview, so it's good to have an idea of what it is and why it's important. So thank you guys for watching. When you get to the interview, just make sure you're super friendly, you're bubbly, you just try and be yourself. They want to see you as a person. That's one of the most important things from all of our colleagues, is making sure that we come to work positive. We want to be there, and that there's got good personalities to help the patients feel a little bit uplifted by us in situations where we can do, obviously. Some interviews there are mini maths tests and English tests just to make sure that you can do simple adding up, multiplication, nothing too strenuous, so don't stress yourself out. That you can read paragraphs and what some words mean. If you've not got an interview yet, good places to look is NHS Jobs online, and if you have no luck applying to the jobs on there, because some of them can be quite hard to get a hold of, a recommendation that I have would be to call your local hospital and speak to their human resource department. Ask them when the next open day is for healthcare assistants. Often hospitals have open days which you can go to, to really showcase yourself, and that's actually how I got my job, because there wasn't any jobs online at that moment. If you're watching this because you've already had an interview, then good luck to you guys. I'm sure you'll do just fine. Don't panic. Just make sure you have a good night's rest and you show up with plenty of energy. And I can't wait to possibly work with you guys in the future. Thanks for watching this video. Make sure you click the subscribe button. It really helps my channel to grow. helps me to carry on making more videos that help people like you get where you want to go, especially in healthcare. Thank you guys, lovely to meet you, and ciao ciao for now.